Hi. You should have read the Atul Gawande piece, the mop-up on the efforts to eliminate polio and to eradicate it in India. I want to emphasize that piece was written in 2006, at which point they believe that we might be only, I think it's 5 years away from eradicating polio around the world. We still haven't reached that point, and people keep thinking it's sort of 5 years away, and it keeps being difficult. The good news is that they have eliminated polio in India. The last wild case of polio was found in 2011. And so after 3 years without any cases of the disease, they were able to officially declare India free from polio. So what I want to talk about today is some of the issues of the attempt to eradicate disease. What makes it possible? What makes it hard? What are some of the techniques they use? And address to some extent the question of, is it worth it? Because as you saw in that article, there's a huge amount of effort that goes into it. So let me bring up my slides. Hello. There we go. Okay. So you should watch this after you have read that Atul Gawande piece. So just a little bit of vocabulary first. There are two very different terms, elimination and eradication of a disease or an infection. An elimination of a disease means when you've gotten rid of the endemic level in an area, when you've reduced it to zero, when in a specific geographical area, there is no ongoing transmission of that disease as a result of some deliberate effort. And we have eliminated a lot of diseases from a lot of regions of the world. For example, measles has been eliminated from the Americas. There is not endemic measles. All of the various measles outbreaks you've heard about have been seeded by somebody traveling from somewhere where measles was endemic to the United States. There was some concern in some of the outbreaks in 2019 that measles might essentially escape and become endemic in the United States again, but they managed to keep all those outbreaks under and contained and get rid of all of the cases. Similarly, polio has been eliminated in the Americas and actually in the vast majority of the world. Eradication is different. When we talk about disease eradication, we mean a permanent reduction to zero of the worldwide incidence of infection. And the big deal is that if you're able to eradicate a disease, then it's gone. You don't have to worry about it. You don't have to think about it. Honestly, the one example of a major disease that's been eradicated is smallpox. So, talk a little bit about polio. Before the introduction of the two different polio vaccines in 1955 and the 1961 vaccines, polio was ubiquitous. It was globally distributed, so it was found around the world. In the early parts of the 21st century, the early 2000s, about 70% of the cases were still being found in India, by the way. It infected most people in childhood, and it caused paralysis of roughly 1 in 200 people, which is, I mean, it's not a huge number, but it was a debilitating level of paralysis. And the vaccine was incredibly effective. When they introduced it, it had a rapid effect on decreasing the cases of the disease, which was terrifying. If you have relatives who are, of the early baby boomer generation, they will probably have memories of times in the United States when, I know my mother will talk about times when they weren't supposed to go outside and play in the summers because there were polio outbreaks and the parents were afraid that their children would catch polio. You couldn't go to the pool. You couldn't go out in the summer. So the United States, the vaccine, remember, which was introduced in 1955, was able to reduce cases of paralysis, which for many people were lifelong effects, from approximately 20,000 per year in the early 50s to as few as 61 in 1965. And the last cases of naturally occurring polio in the United States were in 1979, and an outbreak among the Amish. And after that, we had polio eliminated in this country. So the Global Polio Eradication Initiative worked very quickly early on and was able to reduce the number of countries where polio was endemic from 125 in 1988 to only 10 in 2001. And by 2002, the Americas, the Western Pacific, and the European were decreed free from polio. Polio had been eliminated. So huge amount of work, huge benefit. As you saw in the story, the mop-up, going from this great reduction in polio to eradication is taking a massive amount of effort for very, very few cases. The last couple of years before they eliminated polio in India, I think they saw 15 cases. They see small double-digit number of cases these days per year in Pakistan and Afghanistan, which are two of the three countries where polio is still endemic. So there's a huge effort going into changing the outcome for what is honestly an incredibly small number of people. So the question is there a big difference between elimination of polio and worldwide eradication, particularly for people in these regions where it has been eliminated? Is eradication worth this effort, this cost for the rest of the world? You probably already addressed this some in your reading response, but I'd also like you to respond on the form. Okay, so I want to talk a little bit about this difference between elimination and eradication. And that is, if we eliminate a disease in a part of the world without totally eradicating it, then there's still ongoing threat. That's what we're seeing with measles. We need to monitor for measles. We need to keep vaccinating for measles. There are active measles surveillance programs. And there is this constant concern that the disease may come back. In the CDC's language, continued measures to prevent reestablishment of transmission are required. Whereas if you eradicate a disease, it's gone forever. This disease, smallpox, only spread from person to person. So if you had a period of time, they wanted 3 years to be sure, in which no smallpox cases had turned up anywhere in the world, poof, it's gone. You don't need to worry about it ever again. There can never be a smallpox outbreak, short of some, I don't know, bioterrorism level of thing. You don't get vaccinated for smallpox anymore. They eliminated the smallpox vaccine because it just wasn't necessary. So that's a savings in time, in money, in effort. We do not need surveillance programs for it. We don't need to be on the lookout for it. We don't need to think about it. As the CDC puts it, intervention measures are no longer needed. So elimination isn't enough. At the moment, polio is only endemic to 3 countries, Afghanistan, Nigeria, and Pakistan. But as long as it exists in the wild anywhere, it continues to be a global threat. And other countries have seen sporadic outbreaks of polio. In 2014, 2015, there were outbreaks in Syria in the middle of a war zone. It was a mess, and at least 74 children were paralyzed. They were able to then get rid of polio again, so it's back to not being endemic, but there is always this concern that it might spring back up. Whereas if we can eradicate the disease, that feels like a huge amount of effort for some, less than 100 cases, but it's an effort being made not just for the present, but for the future. And it is hard to say how much work we should put in to guarantee a disease will be gone forever, to guarantee that the future won't have to think about it, that it's just a non-issue. And I'll be honest, that's a hard question to think about, and we talk about resource trade-offs when I talked about the cancer screening and the pap smears and the mammograms. In this case, we're thinking about how much money and effort and time are we spending to prevent some number of cases of the disease, like to prevent 1 case of cancer out of 100,000 or out of 1 million people. And we have ways to think about those sorts of trade-offs and numbers and questions about how much money are you willing to spend to save a life or to save a year of a life. It's a lot harder to think about how to weigh money being spent now to prevent a problem for the future and from ever being a problem for the future. So I just want to really highlight that as the issue driving disease elimination, which is a very different one from the issues driving cancer screening. And just by the way, I think I said it already, but since you read it in that story, India, which had been the source of a large percentage of the world's cases of polio, was declared polio-free since 2014, and has managed to stay so with a huge amount of effort in universal vaccination. The polio, and what I was saying, India borders on Afghanistan and Pakistan. So keeping India polio-free requires massive effort. So is eradication possible? Why has it been harder to eradicate polio than smallpox, where there was this very successful eradication campaign a generation earlier? I think it was declared eradicated in the late 60s or maybe 1970s. So here are the sorts of questions people ask when they think about just whether eradication is feasible. The first one is there a reservoir outside humans? That is, does the disease get carried and spread other than in humans? Smallpox, it didn't. And that's why we could say if there had been no human cases of smallpox, the disease is gone. Similarly, polio doesn't get carried in animals. A disease that gets carried in animals, people just cannot imagine any feasible way to eradicate it. For example, Ebola is carried in bats. The West Nile virus is carried in birds. These are diseases we are not going to be able to eradicate. Polio, smallpox, they are purely human diseases, so they are candidates. There's a separate question, which is, can the agent survive outside the human body? This isn't whether disease can be transmitted from animal to animal, but can that virus live for some amount of time outside of people? Smallpox, it can't. Smallpox virus, I don't know whether it can live for a few hours, but as we're talking about timeframes of a week or more, it basically just needs to be transmitted from person to person. So if you have an area where there are no people with smallpox, you know that there won't be any new cases. Unfortunately, polio is difficult because that virus can live for 60 days or so in sewage mostly, which can lead to contaminated food or water. So you can have an area that's free of polio that may neighbor an area where there is a case. If the water gets contaminated, that virus can travel. And that can make it harder to be sure that you have eliminated all cases of polio. So you need to know whether that's an issue or not. And one thing they do for polio is they do surveillance programs where they track and they measure water sources to see if there are any traces of the virus. And it's one way to know if there is an incipient outbreak. They also need to have a way to prevent transmission. You can't eradicate a disease unless you can stop it from spreading. Basically, you need to have a vaccine. Although, if you're interested, there's also this parasite called guinea worm that Jimmy Carter has made it his life's mission to eradicate. Don't read it if you're squeamish, but it is a fascinating story and has been amazingly successful. So you need a disease that doesn't exist in animals. You need to know whether it can survive outside the human body, which is part of what made smallpox easier to deal with than polio. You need something like a vaccine, and you need to detect levels of infection that can cause transmission. If there's asymptomatic cases of a disease, it can be a lot harder to stop. Again, this is a case where smallpox was much easier to deal with than polio. Smallpox didn't come in asymptomatic cases. If you had a case of the disease, you knew about it, and you were able to detect it, whereas you actually can have subclinical polio infections where you don't know that you're sick. So these two things, the agent surviving outside the human body and the subclinical polio infections, would make it sound like it was virtually impossible to eradicate polio. And certainly show why we had an easier time with smallpox. So it's come down to saying vaccination and surveillance are certainly a key. They're absolutely essential if you want to eradicate a disease in the first place. You need to start with widespread vaccinations, with international campaigns. At the moment, Afghanistan and Pakistan, which are two of the three countries where it's still endemic, there are mandatory oral polio vaccinations at ground crossings between Afghanistan and Pakistan. You cross, somebody is going to drop the polio vaccine into your mouth. It's a vaccine form which can be administered by non-specialists because it's literally just a couple of drops of a liquid. It doesn't require an injection. So you need widespread vaccination. You need a way to monitor for outbreaks. They check for symptoms of the disease. As I said, they monitor wastewater for traces of the polio virus. There are trained workers who go through and look for minor indications of minor forms of paralysis, which could be indicators of polio. So you need vaccination, you need surveillance, and then you need a protocol for what you do when you detect an outbreak, which is to, well, detect it, isolate the person who's sick, and then ring them with vaccines. That is, you start making concentrated programs to vaccinate everyone in the area in wider and wider rings. And they will say smallpox eradication was a lot easier because every infection was clinically expressed. That is, the disease symptoms were obvious. They were all expressed in the same way. So you could easily tell when somebody had the vaccine, and then you isolate and vaccinate, as I just said, a ring of people around the person. The main expression of polio is paralysis, but for every paralysis case, there are at least 200 children that are infected, maybe not totally asymptomatically. They might get mildly sick, but not in a way that can allow you to identify polio. So it's really hard to find every polio infection. So I wanted to show you a couple of pictures, actually. These are at the Pakistan-Afghanistan border. This is a checking for symptoms. Again, people who have been infected with polio may have mild cases of paralysis in some limbs, which it isn't as extreme as paralysis might make sound, but there are workers at these borders trained by the Rotary Club, actually, who check for these signs of paralysis because they would be indicators of a polio outbreak. Again, they've only had small double-digit numbers of actual cases, but there is this extensive monitoring program still going on. This is a case of testing for paralysis, and here's a vaccination. You can see this worker that's the bottle holding the oral polio vaccine drops, and they're going to drop it probably in both the kids and the adults' mouths. Adults who pass the border routinely can get cards saying they've been vaccinated, and I think it's in the last month or a certain number of times in the last year, and don't need to be vaccinated again. But other than that, you walk through that border, they put those drops in your mouth. So that's a lot of work, and it's work that they would need to do even if there hadn't been any cases of polio in a year, because they want it to be gone. They want to be sure it's gone. And without this intensive surveillance and vaccination, they won't be sure. However, if they can get 3 years without the disease, then they can stop that program. And that's a big savings. So I'll talk a little bit more about vaccination. The problem is, at first, in the early days of the polio vaccine and the early days of the smallpox vaccine, people were eager to get vaccinated. These diseases were terrible, and everybody knew somebody who had had them. But as the disease cases drop off, resistance to the vaccination increases because people aren't as immediately aware of the danger, and rumors start to spread. Rumors about the disease, the vaccination causing infertility, causing autism, being a plot by whoever your other is to harm us. And so those final cases, those wrap up, get much harder. These days, there are some reason to believe that those rumors are weaponized. They are used by groups that want to sow division, essentially, and distrust. In the United States, there is certainly some evidence that measles vaccine denialism is being spread by those same Russian bots that we've heard so much about. Not because I really care about whether there are measles outbreaks in the United States, but because if they can convince people to not trust the authority figures in some ways about measles, perhaps the belief is it will sow a general level of distrust and discord. So this all gets weaponized. One interesting thing about polio that makes it possible to eradicate the disease, we've seen some ways that we think it would be very hard, is that the vaccine itself is actually subclinically infectious. People can get infected. If you're infected with a low level of polio virus, you don't get sick, but you do get immunities, and that's what the oral vaccine gives you. And not only does it give you, the person who's vaccinated, a low level of immunity, you also shed, if you get the oral virus, you shed low levels of the virus. Too low to get people sick, but low enough to spread immunity. So the oral vaccine can itself, and this is bizarre, no other disease works like this, spread immunities. There have been a few outbreaks of the actual disease caused by oral vaccine, which has, of course, spread distrust, and it is a very complicated story. If you're curious about it, I have more readings. So those are some of the things I just wanted to talk about to fill in, I thought, some more details about this question of disease eradication, which I happen to think is a fascinating one. Starting next week, we will have the last few videos and slides on reproductive number and herd immunity, and talk some more about vaccination, not in an environment in which eradication is possible, but vaccination like we use it for the United States in measles and a bunch of other diseases. Okay. Nope, I need to